Hi, everyone. So today my presentation is on traumatic brain injuries. Start this. Just a brief overview. I'm going to be going over the etiology, the demographics, the anatomy, the physiology, and the diagnosis of a TBI. A traumatic brain injury is acute brain damage as a result of trauma to the brain. It's usually caused by an external force to the brain, damaging the tissues. It can be defined as penetrating or non-penetrating. The impact of the force plays a huge role in how these brain injuries will be classified. They can be classified as mild, moderate, or severe. A mild TBI, or what's commonly known as a concussion, it can occur when there's a sudden jolt or impact to the head. The impact basically causes the brain to bump against your skull, which, as you know, the brain is suspended in the cerebrospinal fluid. So when this happens, it can be really damaging depending on how hard it hits. Physical symptoms would include headaches, dizziness, vomiting, equilibrium issues, light sensitivity, trouble concentrating, thinking, memory loss, and grogginess. And moderate to severe traumatic brain injuries, they'll be defined as moderate when a person experiences a loss of consciousness for over 30 minutes, but under 24 hours. It's defined as severe when the loss of consciousness persists after 24 hours. So if they're out, completely out for 24 hours or over, they definitely have a severe TBI. And again, the classification is very much based on the severity of the impact and the pathological features that go along with it. Physical symptoms can vary a lot, but the most common of these would be loss of consciousness, persistent vomiting, seizures, dilation of one or both pupils, fluid drainage from the ears or nose, numbness or tingling in the fingers, profound confusion, coma, vegetative state, and brain tissue death. So there are lots of different behavioral risk factors that go along with traumatic brain injuries. Occupational hazards are a big one, especially construction workers, athletes, whether they're professional or non, military members, law enforcement. Also, there's a huge population of people suffering with TBIs who are in domestic violence situations, child abuse, which you commonly know as shaken baby syndrome, car accident, suicide, homicide, and drug and alcohol addiction. These are especially prevalent due to being, just drunk or high, and you obviously lose your balance, and it's really dangerous, and your chances of getting a traumatic brain injury increase a lot. Approximately 223,000 TBI related hospitalizations in 2019, and approximately 64,362 deaths. The difference between life and death in these situations, especially with the, mild to moderate TBIs, going to the hospital and getting treatment plays a huge role in how soon you're treated and how much brain damage is detected. These are highly preventable deaths, obviously. Mostly they're all accidental. There's nothing genetic that leads to a traumatic brain injury unless you have some sort of other, illness that affects um, your how you ambulate or things like that. So, these are highly preventable. Males were nearly 2 times more likely to be hospitalized and 3 times more likely to die than females. And then this is just a chart, basically going through each age group. Per 100,000 cases of reported TBI deaths, unintentional motor vehicle crashes, the 15 to 24 age group had the highest incidence of 4.7%. Unintentional falls, definitely in the 75 plus age group, is 54.3%. They're at very, very high risk for TBIs. Unintentionally struck by or against an object. This is kind of like the least common, but the 55 to 64 age group is at 1%. Suicide is the 55 to 64 age group is the highest at 8.7%, and homicide, the 25 to 34 age group, is the highest at 2.9%. So some anatomy of a TBI, obviously a concussion is the most common. We all know what that means. It's when the brain accelerates and deaccelerates. This can cause the brain to be permanently damaged, but usually, depending on the severity, people can recover in a couple weeks. The blast injury, which also known as shell shock, which we see a lot in members of the military, in war zones. This is caused by an explosion or a large blast, which sends acoustic waves through the brain. This causes the blood vessels in the brain to expand and contract rapidly during the wave, which will likely be equivalent to the force of a direct hit to the head. TBIs will be classified as focal or diffuse injuries. So focal injuries are basically, localized injuries like a concussion or not a concussion is a diffuse injury. So the focal injuries would be a contusion or a hematoma, or a hematoma as the result of a skull fracture. And then a diffuse injury will be something more widespread in the brain, such as, a hemorrhage. These are images of MRI scans. So images A, B, and C, as you can see, these are hematomas in the brain. B, I believe, is an epidural hematoma. C is a subdural hematoma. And then, images D through I shows diffuse injuries, which you can see there's not really any specific area that's, shown. There's no spots. It's just, all the brain activity and the areas around the brain are affected. It's really important to get anytime you hit your head, to get checked immediately, because if you don't, you run the risk of developing a secondary brain injury, which is basically, a cascade of events that will lead to increased intracranial pressure. But as far as the focal brain injuries, which are most common, an epidural hematoma is caused by a fracture to the pterion, the thinnest part of the skull. It will sever the meningeal artery, causing profuse bleeding. There's a buildup of blood between the dura mater and the skull, and it will cause a lucid interval increasing cranial pressure. This will, in patients with an epidural hematoma, you'll see an initial loss of consciousness, not for that long, and then they'll have a period of lucid consciousness, where they wake up and they are acting fine, and then all of a sudden they decline very quickly. The intracranial pressure increases rapidly. Surgery is usually done for patients who have this type of hematoma. Another hematoma is a subdural hematoma. It's caused by a buildup of blood between the dura mater and the arachnoid mater. This is a disturbance to the veins, so there's not so much of a buildup of blood happening so quickly as you would see in an epidural, which is damage to the arteries, because we know that veins, they don't use as much pressure as arteries. So this can progress really slowly. And, this is usually caused by the acceleration and deacceleration of the head. So like a whiplash type of situation. Also, this is common in alcohol abusers and the elderly, because their brain is starting in alcohol. When you use alcohol, it shrinks your brain, and it causes the veins to be stretched out. And this can lead to a subdural hematoma. And then one of the most severe injuries is a subarachnoid hemorrhage. This occurs between the arachnoid mater and the pia mater. It can happen as a result of an aneurysm rapidly rupturing. This has a poor prognosis. You can't really treat it with surgery. People who experience subarachnoid hemorrhages often say that they are experiencing the worst headache they've ever had in their lives. And they'll definitely have a change in consciousness and severe confusion. Diffuse axonal injuries are when basically when the neurons stretch. So if you're, rotating your head really fast or accelerating, deaccelerating really fast, this causes your axons to stretch, and it damages the axon itself and the white matter, and it will cause long-lasting damage for sure. And then the brain herniation is basically when one part of the brain is pushed to another part of the brain. This can be the result of swelling, or a hemorrhage, or a hematoma. This compresses your cranial nerves, and it will cause a disturbance to the system of whichever nerve that it's pressing on. And this will cause a lifetime deficit for sure. So treatment of TBIs, especially when you go into the ED, they'll immediately use the standard Glasgow coma scale. And for this, the patients with the highest score will basically have the most mild TBI. With the least score, patients will have a severe TBI. Other diagnosis can be a CT scan, which is pretty much always done in the ER, especially if your coma score is super low. An MRI scan can be done, but it's not common unless the patient is pretty stable, because just because of the technicalities of the MRI scan. Intracranial pressure monitor, that's when they insert a probe into your skull to check to see if there is any intracranial pressure. The normal rate of ICP is between 5 and 15 millimeters of mercury. The abnormal rate is usually over that. Medications can be given, anti-seizure medications, coma-inducing medications, diuretics can be given to, if there is a buildup of fluid, that they would want to start having the patient trying to urinate as much as possible. Barbiturates can be given to induce sleeping. And then surgery will be done if you do see a hematoma, for sure, to remove it or to drain it. And some hematomas can be absorbed in the brain, so surgery is not always necessary. It just depends on how stable the patient is and their age, and all those factors play a part in it as well. Skull fracture repairs and the craniectomy is the removal of a piece of skull to relieve intracranial pressure buildup. This will really only be done on super healthy, stable patients. Like you wouldn't see typically an elderly person getting this procedure done because it is super dangerous. And that is it for my presentation. Thank you very much.